my presentation is on understanding electrolyte relationships between potassium and sodium. So let's get started. So fluid and electrolytes in the human body. Some key points to remember is that electrolytes are charged particles that are essential for various bodily functions. And major electrolytes include sodium, potassium, calcium, chloride, and bicarbonate. And they also help maintain nerve function, muscle contraction, fluid balance, and acid-base equilibrium. And finally, electrolytes move across cell membranes to maintain homeostasis, and it is regulated by the kidneys and hormonal systems. So the relationship between potassium and sodium. So for sodium, it is predominantly found in the extracellular fluid, and it regulates fluid balance and blood pressure and nerve and muscle function, while potassium is predominantly found in the intracellular fluid, and it is crucial for cell function, muscle contractions, and nerve signals. And the relationship between these two is that the sodium-potassium pump actively transports sodium out and potassium into the cells, and it maintains cell potential and fluid imbalances, and it is essential for muscle contractions and nerve impulses. So the causes of the imbalances. So for sodium, if it is elevated, it's going to be called hypernatremia, and the causes of this is excessive salt intake, dehydration, and renal dysfunction, and the effects it'll have on you is hypertension, edema, and confusion. Now, if your sodium is decreased, it would be hypernatremia, and the causes is overhydration, renal issues, and diuretics, and the effects it'll cause is weakness, confusion, and seizures. And for potassium, if it is elevated, it is hyperkalemia, and the causes of this could be from renal failure, excessive intake, and cell damage, and the effects it'll give is arrhythmias and muscle weakness. And if you have decreased potassium, it'll be hypokalemia. And the causes of this would be diuretics, vomiting, and diarrhea, and the effects it'll have on the body is muscle cramps and arrhythmias. So the interventions for the imbalances. So for sodium imbalances, if for hypernatremia, you would need to increase water intake and administer IV fluids with lower concentration of sodium. And you would want to monitor renal function and diuretic use. For hyponatremia, which is low sodium, you would have to reduce fluid intake and administer IV sodium chloride and monitor for underlying causes. For potassium imbalances, for high levels of potassium, which is hyperkalemia, you would need to limit dietary potassium, use medications like insulin and glucose to shift the potassium into the cells, and administer calcium gluconate to protect the heart. And for hypokalemia, which is decrease in potassium, it would be to increase dietary potassium, administer potassium supplements orally or through IV, and monitor for diuretic use and GI losses. So here are some key points for the importance of correcting imbalances. Make sure to maintain electrolyte balance because it is crucial for cardiac function, muscle activity, and overall cellular processes. And it prevents severe complications like cardiorhythmias, neuromuscular disorders, and fluid imbalances. And it also ensures proper physiological function and patient safety in clinical settings. So just some probing questions for discussion. What are the potential long-term consequences of chronic electrolyte imbalances, and how do various medications affect electrolyte imbalances, and what monitoring strategies would you recommend? And finally, here are the references. Thank you.